Murphy. Senator Hyde-Smith.
Thank you, Mr. Chairman. Secretary Azar, thank you so much for being here today, and I want to start by making a few comments before I go to my question. First, I know you've heard from Chairman Blunt repeatedly about his concerns regarding the allocation of livers for transplant. I share the Chairman's concerns. Our only transplant program in Mississippi at the University of Mississippi Medical Center just completed its 250th liver transplant this past Friday, which is a very important milestone for us. Since the program started in 2013, it has meant so much to critically ill Mississippians to be able to get this life-saving care close to home. And I'm worried now the new liver policy will undercut that UMMC program. I hope you will work with us to address these concerns and ensure the continued viability of new liver transplant programs, just like the ones that we have in Mississippi. Secondly, I want to thank you for your focus on lowering the cost of prescription drugs for all Americans. Whenever I'm in Mississippi, I constantly hear from constituents who are concerned about high out-of-pocket costs for their prescription drugs, but both you and the President have made this a issue of priority, and I certainly thank you for that. Third, I was very pleased to see your budget request include legislative provisions from the Connect for Health Act to help expand telehealth at community health centers, rural health clinics, and Indian health services facilities. As one of the 6 senators on the Senate Telehealth Working Group, I was very glad to be able to introduce this bill, and I'm working to get it enacted into law. Your support is extremely critical in that. At this hearing last year, you and I discussed struggling rural hospitals in Mississippi. This continues to be a problem not only in my state, but across the nation. The most recent data just released from 2019 shows that nearly 50% of rural hospitals are still operating in the red. Last year, I was so pleased when you testified that, in part because of some efforts from my office, you had established a rural health task force at HHS to find all the ideas to help address the crisis in access in rural America. I've also been pleased to support some of the early work on the task force, including changes to the Medicare wage index that meant so much to our rural hospitals in Mississippi. But I know the task force has been working very hard in recent months to do even more. Can you provide us with an update on the task force work and specifically how this subcommittee can help support you and your office in that?
Thank you, Senator. And yes, on the rural task force, we've now matured into the point that rural health care is a centerpiece of the President's health care agenda and a centerpiece on the budget proposals. There are really 4 pillars to it. The first is rural health care has to have a sustainable business model. We can't just patch over it. It's got to be something that economically works in our rural communities. Second, we've got to have prevention and health promotion in rural communities. Third, we have to take advantage of telehealth and other innovation. And fourth, we need health professionals such as PAs, physician assistants, nurse practitioners, and others who are able to practice at the full extent of their training and licensure in these rural communities where we can't often find just doctors to practice. So we have many proposals in the budget. One of them, which I'm very excited about, that would help with rural hospital closures, would allow critical access hospitals to convert to emergency facilities with an emergency room and outpatient and not have to bear the burden of continuing inpatient bed facilities, and also get payment supplements on that. So I think that could be a real lifeline to our rural communities if we can get that approved. We also have several provisions we've proposed on expanding access to telehealth and compensation, both in rural America but also in Indian country for facilities there. And then we also want to modernize our payment for rural health clinics, because our community health centers in rural areas can be an important backbone of our system also. So we've got a whole suite of legislative proposals in there for rural health, combined with our budget increases that we'd love to work with you on.
Thank you very much.
Thank you, Senator Hyde.